Good afternoon, everyone. I am Michael Strom from Oasis Senior Advisors, and today we have the pleasure of interviewing Tony Ortiz from NRC Research Institute in Orange. Tony, how are you today?
Hi, I'm doing well, Michael. Thank you for taking the time to interview me today.
Oh, my pleasure, my pleasure.
Great.
So I was wondering, could you tell us a little bit about your background and your background for your organization?
Yes, I would love to. My name is Dr. Tony Ortiz. I'm a founder and scientific director at NRC Research Institute. NRC Research Institute was founded in 2005, and we focus on the research and development of new medications for diseases and disorders associated with psychiatry and neurology.
Well, excellent, Tony. Thank you for telling us a little bit about your background. So now could you tell us a little bit about why are clinical trials important?
Yes, of course. Clinical trials are an essential component to the drug development process. A clinical trial is needed to determine if a medication is safe and effective. More importantly, participants are necessary to the clinical trial process. Without participants, we are unable to determine if a drug is safe and effective.
Well, great, Tony. So now could you tell us what are the benefits of participating in a clinical trial?
Yes. There are many benefits in participating in a clinical research study. One benefit is that there is an exhaustive medical evaluation that is conducted to determine if you are in good health to participate in a research study. There is usually a physical exam, blood analysis, and your diagnosis can be confirmed with a psychiatrist and a psychologist to determine if you are a good fit for the research study. Sometimes these evaluations are more in depth than what your primary care physician does at your routine medical checkup. And in addition, your time and travel is compensated for your participation in these clinical research studies.
So Tony, could you tell me, are there any research studies that are interesting going on right now?
Oh, yes, of course. We at NRC Research Institute have taken a very strong and passionate interest in Alzheimer's disease. As you know, there is no current cure for Alzheimer's disease. What is more bothersome is that there has not been a new medication approved by the FDA since October 16th, 2003. To put this in relative context, in 2017, there were 2 medications approved for type 2 diabetes. There were 5 medications approved for various neurological disorders such as Parkinson's disease and tardive dyskinesia. And thankfully, there have been 12 medications approved for different forms of cancer. In 2015, there were 19 medications approved for different forms of cancer. So let's re-highlight this. There has not been a drug approved for the treatment of Alzheimer's disease for almost 15 years, and that is what we are becoming more passionate about.
Well, Tony, that's fascinating. So is NRC working on any clinical research trials right now currently for Alzheimer's?
Oh, yes, we are, Michael. At NRC Research Institute, we are working on a variety of research studies in identifying new treatment options for Alzheimer's disease. Most of our studies, we are attempting to look for participants that are in the early stages of Alzheimer's disease. There is also an agitation associated with Alzheimer's disease study that we are currently looking for participants.
Well, thank you, Tony. So now could you tell us if what a senior and their caregiver could expect if they were to participate in one of these clinical trials to some of these Alzheimer's studies?
Of course. A senior and their caregiver can attend this first screening visit, which again is where a medical evaluation is performed, such as a physical exam and routine blood testing to determine if there are any significant medical conditions. There is also an opportunity to obtain a brain scan. It is usually a CT, an MRI scan, or even a PET scan, and this is part of the disease confirmation process that we go through to ensure that the patient is appropriate to enroll into a clinical research study. Once it is determined by our investigators that a patient is eligible to participate in a clinical research study, they get the actual medication, and they come to the research site over a period of 6 months to determine if there are any significant side effects to report and if there's any changes in their cognition and or their agitation.
Well, thank you, Tony. So now if a senior would like to find out more information and contact you, how would they do that? And also, where are you located?
Yes. NRC Research Institute is located in the city of Orange. For more information regarding our clinical research studies, you can call 714-289-1100. Again, 714-289-1100, and you could ask for Daniela, who is our recruitment supervisor. You can also check on our website, nrcresearch.com, and click on the Participate tab, and you could enter in your information, and we should respond to you within 24 hours.
Well, thank you, Tony. So is there anything else you'd like to mention about NRC?
Oh yeah, NRC Research also conducts free memory screens for the community. If there's anyone that is interested, they could simply just call us at NRC Research Institute and make an appointment for one of our complimentary memory screens.
Well, excellent. Well, I really appreciate your time in talking with us today.
And thank you, Michael, for your time.
Thank you. Bye, everybody.